Have you ever done everything right and still stared at a blood pressure reading that made your heart sink? Imagine eating perfectly, walking every day, avoiding smoking and alcohol, cutting back on salt, and yet every time you check your numbers, they stubbornly stay high. You might start thinking, am I broken? Is this just aging? But here's the thing, your body isn't punishing you for being good. In fact, most of the patients I see who are doing everything right aren't failing at lifestyle. They're falling victim to a hidden signal inside their bodies, one that keeps blood pressure high no matter how perfect their habits look on paper. Today, we're diving deep into why healthy people still struggle with high blood pressure, and the answer may completely reshape how you think about managing your heart, kidneys, and overall health. Most people are taught a simple equation. High blood pressure equals too much salt. So naturally, you slash sodium wherever you can, thinking that's the magic fix. And yes, salt does matter, but here's the kicker. For a large portion of adults, especially those over 60, blood pressure isn't primarily a salt problem. The real culprit is hormonal, and it's one that hides in plain sight: insulin. Most people only think of insulin when discussing diabetes, but its role in blood pressure regulation is massive. Every time insulin rises, it tells the kidneys to hold on to sodium, keeps the nervous system slightly activated, and prevents blood vessels from fully relaxing. This is normal in short bursts, like after a meal. But when insulin stays elevated for long stretches, your body never gets the chance to reset. And that's when even a healthy lifestyle starts to lose its power. Think about a typical day. Breakfast, a mid-morning snack, lunch, an afternoon snack, dinner, maybe an evening smoothie or protein shake. Even when all the foods you eat are healthy, the timing matters physiologically. Each eating event triggers insulin. If these events are spaced too closely, insulin never returns to baseline. Instead of a rise and fall, it stays elevated constantly. This keeps the kidneys locked into sodium retention mode, blood vessels slightly tense, and your nervous system in a mild state of activation. The result? Your blood pressure stays higher than it should, even though everything else looks perfect. This explains the frustration I see daily. People are doing all the right things, yet their internal signals are working against them, and their numbers refuse to budge. Here's a visual I like to use. Imagine your bloodstream as a highway. Sodium is the number of cars on the road, and your kidneys are the exit ramps. Insulin is the traffic light controlling those exits. Cutting salt is like reducing the number of cars entering the highway. It helps a little. But if the exits remain closed because insulin stays elevated, traffic backs up no matter how few cars are on the road. This is why aggressive salt reduction sometimes makes no difference at all. The congestion inside your body is dictated not by intake alone, but by the signals telling your kidneys when to release sodium. And when those signals are constantly on, the result is chronically elevated blood pressure, often without any outward signs that something is wrong. Another common pattern I see is morning spikes in blood pressure. Most people assume stress is the reason, but in reality, it's often the timing of your meals. Late night eating, even of healthy foods, keeps insulin elevated while you sleep. Your kidneys continue to retain sodium, your nervous system never fully relaxes, and your blood vessels miss their nightly recovery window. By the time you wake up, your blood pressure is already starting from a higher baseline, leaving many patients shocked by readings that don't match their healthy lifestyle. And it gets even more intriguing. Some of the people most affected by this phenomenon aren't overweight, they're fit, active, and lean. That's because normal weight doesn't automatically mean metabolically healthy. This brings us to the hidden metabolic trap: visceral fat. There are two main types of fat: subcutaneous fat under the skin and visceral fat packed around internal organs, especially the liver. Visceral fat is metabolically active and interferes with insulin signaling, driving chronic insulin elevation. You can appear lean and healthy, have perfect labs, and still carry enough visceral fat to keep your insulin and your blood pressure high. Your pancreas compensates to maintain normal blood sugar, but the result is a stealthy, persistent hormonal environment that quietly nudges your blood pressure upward all day. This is why patients often feel confused and discouraged. Their numbers are high, but nothing on the surface suggests why. Let me be clear. The most common mistake keeping blood pressure elevated in otherwise healthy individuals isn't overeating, junk food, or lack of discipline. It's constant feeding. Grazing all day, drinking liquid calories like smoothies or protein shakes, and late night snacking all keep insulin elevated for extended periods. This prevents your body from entering a low insulin state, leaving kidneys holding sodium, blood vessels tense, and the nervous system slightly activated. Over time, this pattern resets your baseline blood pressure higher, leaving you waking up behind every morning. But here's the good news. This is completely reversible once you understand the signal and allow your insulin to drop periodically. The fix isn't extreme dieting, keto, or multi-day fasts. It's simple. Create insulin low windows. Stop snacking between meals, finish dinner earlier, and compress eating into a 10 to 1-2 hour daily window. When insulin falls, your kidneys release sodium, blood volume normalizes, blood vessels relax, and the nervous system calms. In just days to weeks, blood pressure can start to come down naturally without medication, because you've addressed the signal that was driving it all along. And this isn't just about numbers. It's about long-term cardiovascular health, reducing mechanical stress on your heart, kidneys, brain, and blood vessels, and creating the foundation for healthier aging into your 60s, 70s, and 80s. If this information has already shifted your understanding of blood pressure, you're ready for the next step. Applying it in a practical, everyday way that actually lowers your numbers permanently. In my next video, I break down the best 3 exercises to naturally lower blood pressure and how combining them with proper meal timing and insulin control can make the difference between constantly chasing numbers and truly stabilizing them for good. But before we get there, it's important to fully grasp the why behind this signal-driven high blood pressure, because without it, any plan will feel like a shot in the dark. Now that we understand the hidden hormonal signal driving high blood pressure, the next question is obvious. How do we actually take control? How do we flip that switch and let our body's natural systems do the work? The answer lies in a combination of timing, movement, and simple daily habits that reprogram the signals your kidneys, blood vessels, and nervous system are sending. And what's remarkable is that these strategies don't require radical diets, expensive gadgets, or hours in the gym. They take just minutes each day, but can make a profound difference, especially for adults over 60. The first and most powerful tool we have is the timing of your meals. It might sound too simple, but when you compress your eating window into 10 to 12 hours and stop snacking in between, you give insulin the chance to fall naturally. Think of it as hitting a reset button. Each pause between meals allows your kidneys to release retained sodium, your blood vessels to relax, and your nervous system to shift out of constant activation. It's like giving your body a few moments of peace it hasn't had in years. Even just 1 extra hour of insulin-free time can start to reduce blood pressure over the course of a week. And over several weeks, the effect compounds. But here's the catch. Consistency is key. Skipping this step, even occasionally, can erase the progress, because the hormonal signal that drives high blood pressure returns immediately. Next, we add movement, but not the high-intensity, sweat-dripping kind that scares some older adults. I'm talking about specific targeted exercises called isometric movements. Unlike cardio, which moves your muscles through space, isometric exercises engage your muscles under tension without movement. This steady tension sends a signal to your blood vessels to relax once the contraction ends. The 2 exercises I teach most often are wall sits and planks. A wall sit is as simple as sliding down a wall until your knees bend into a challenging but manageable position, holding it and then releasing. Planks are similar, engaging your core and upper body to create steady pressure. Start with 20 to 30 seconds and gradually work up to 2 minutes per exercise. 6 minutes of total isometric work per day is enough to noticeably improve arterial flexibility, lowering systolic blood pressure by an average of about 10 points, almost like taking a prescription medication without the side effects. Once your arteries are softened, the next step is activating your body's natural brake, the vagus nerve. This is where controlled breathing comes in, and the technique is called resonance breathing. For just 3 minutes, you inhale through your nose for 5 seconds and exhale through your mouth for 5 seconds, repeating 6 breaths per minute. This simple practice restores balance to the autonomic nervous system, slowing heart rate, relaxing blood vessels, and reducing stress hormone levels. In adults over 60, this effect is amplified because the parasympathetic nervous system, the calming side, tends to weaken with age. By practicing resonance breathing daily, you literally teach your cardiovascular system that it's safe to relax, which results in lower blood pressure almost immediately. Finally, we complete the routine with hydration, the often overlooked piece that quietly drives blood pressure higher. When you're dehydrated, blood volume drops slightly, and the body compensates by constricting blood vessels and increasing pressure. Drinking 12 to 16 ounces of water slowly over 3 minutes is enough to improve circulation, reduce vascular resistance, and further signal your nervous system to relax. The water intake not only hydrates but also reinforces the calming effects of your breathwork, creating a powerful synergistic effect. It's simple, effective, and something everyone can do. So, when you combine meal timing, isometric exercises, resonance breathing, and hydration, you have a full 10-minute daily routine that addresses high blood pressure at its source. 6 minutes of muscular engagement to loosen arteries, 3 minutes of controlled breathing to reset the nervous system, and 1 minute of proper hydration done consistently reprograms your body to naturally lower blood pressure. And the best part, it's sustainable, safe, and incredibly effective for older adults, even those who are already healthy but still struggle with stubbornly high readings. But here's the twist. Habits are only as strong as your ability to stick with them. Even the best routine won't work if it's forgotten or skipped. That's why I recommend pairing this 10-minute routine with something you already do daily, like brushing your teeth or having your morning coffee, so it becomes automatic. Tracking your streak on a calendar and practicing with a partner for accountability can drastically increase consistency. And if 10 minutes feels like too much at first, start with 5. It's the consistency, not the intensity, that matters most. The body responds to repeated signals over time, and every session compounds the benefits. Even after implementing this routine, some people may still wonder if there's more they can do. And there is. For those looking to take blood pressure control to the next level, combining this routine with proper nutrition, strategic supplementation, and stress management creates a complete evidence-based system for lowering blood pressure naturally. This is the difference between chasing numbers with temporary fixes and creating long-lasting improvements that support your heart, kidneys, and blood vessels. It's about solving the root cause, not just masking symptoms. Now, this is where most people stop and feel overwhelmed, thinking, this sounds like a lot. But here's the thing. You don't have to do everything at once. Start with the 10-minute daily routine, focus on consistency, and allow your body to adapt. The moment you start seeing your blood pressure respond is when motivation skyrockets. And once you've mastered that, layering on the nutritional and supplemental strategies becomes natural, almost effortless. But even before that, understanding why your body resists lowering blood pressure is crucial. Because if you ignore the hormonal signals, no amount of dieting, exercise, or medication adjustments will get you the results you want. The most empowering part, this approach works for people who feel perfectly healthy and look fit. Even if you exercise daily, eat clean, and maintain a healthy weight, controlling insulin timing and retraining your arteries and nervous system can reveal improvements you didn't know were possible. For older adults, this isn't just about numbers. It's about protecting your heart, brain, and kidneys, maintaining independence, and creating a foundation for decades of healthier living. But here's the cliffhanger. While this 10-minute daily routine is incredibly effective, some people still need one more piece to reach optimal blood pressure naturally. There's a small set of supplements and targeted nutritional adjustments that, when paired with this routine, can accelerate results and support long-term cardiovascular health. In the next video, I'll break down the 5 most effective supplements that work with your body to lower blood pressure naturally, safely, and permanently. If you thought this routine was powerful, wait until you see how these additional tools amplify the effects.